Well, welcome everyone for joining us. We're going to get started with a few organization updates, just to let some other people join. But again, we're really happy that you all decided to join us here. And with that, I'm going to pass everyone off to Jen.
Thank you. Thank you. Our big thing we have coming up, and I really want to stress this and hope that you're all able to um, join if you're able to, is registering for the 10th International Conference on Adolescents and Adults with FASD. It is a phenomenal lineup of speakers that we have, great opportunities for interaction, community building, a really good track for older adolescents and adults with FASD to join in on. Just a great joining of the community out in Seattle in April. And really hope that as many of you as possible can join us. This is the big FASD conference for the US that involves researchers, clinicians, people with FASD, families and caregivers, and we want to make sure that it's sustainable. We had the first year this conference ran, 60% of the individuals who attended were from Canada. Given the fact that relations are a little different currently, and I see a few of you smirking at that. We do not have as many Canadians joining us and people from other countries joining us for this conference. And for sustainability, we really do need to have as many as people as possible join. So we just really encourage you to come if you can. We'd love to see you there. And it really is, like I said, a phenomenal program that's been lined up. I believe for parents and caregivers, there is a reduced rate. People with FASD are free. And again, hope to see you there. That's our big news and update. I would pencil in the dates, the September 27th through the 30th for Impact Week this year also. So if a trip all the way out to Seattle isn't going to work for you this year and you're on the East Coast and going to DC might be a little easier, or if timing just doesn't work out, we are working around FASD Awareness Day because we want to make sure that people are in their home communities for that. We're working around the European Conference on FASD because we want to make sure that people have an opportunity to attend that. So we're a little later in the month than we usually are for Impact Week. As a reminder, Impact Week, we are doing our level best to keep that a free event. So that as many people as possible can attend that. If you're interested or excited about what we have for programming for that event, please reach out. We'd love to talk about it, connect, and let you be a part of it too.
Thank you, Jen. Really looking forward to that later in the year. Just want to also add for any affiliate organizations that we have joining us today, Emma Baldwin, our affiliate director, wanted us to let everyone know that there should be an affiliate task forces and coalitions work group starting up at some point this year. So if you're interested in coalition building, helping affiliate members come together with shared interest, make sure to connect with Emma. That's Baldwin at FASDunited.org with any more questions or any interest.
And just of note for that work group, you do not have to be an affiliate to join it. We're not trying to gatekeep that. So if you're interested in that, definitely reach out to Emma, and they've put their email in the chat.
Thanks for that, Jen.
No problem.
And Jen, we can have you keep on going with the good old, what is the FASD Respect Act and what did it do?
All right. And at its core, and Susan, please pipe in because you wrote it, so you kind of have the gist of what it's doing. It authorizes programs. It programs and services for awareness, education, training, um, not just for prevention, but also for support for people with FASD, looking at state and tribal capacity building. And we're going to talk a lot more about this later on, but just how the importance of states in this process. And then also to help create a national clearinghouse to support systems of care. So people aren't starting over and reinventing the wheel and wasting time, effort, and energy and putting things together that maybe are already there, right? So it's intended to provide authorization for that coordination. Um, and really looking at FASD through the lens of support and coordination. How can we do more together? It's looking at weaving a thread of FASD informed care throughout existing state infrastructure, and then looking at the lack of awareness and gaps in support, and trying to figure out where we can put FASD informed care into that. So that's the intent with the act, really, is to build up and connect.
And Jen, you did a great job. And I just also want to do a shout out to the Florida Center. I thought in the roundup, there was a good article by the Florida Center on what the Respect Act does. And I think a lot of that FASD informed care was an integral part of it. Was just like one sentence in the bill, but that really was intentional to have that in the new language in the authorization. So I think you covered it. Unless anybody has any questions at this point in the intent.
Well, thank you, Jen and Susan. I'm without the faces of everyone who's joining here. So if anyone does have a question, please feel free to stop me and we can address there. It's obviously very important to understand what the Respect Act did, what it authorizes, and also how to communicate that with its intent. I think it's also important to understand what the passage of this bill did not do. It did not automatically implement these programs, and it will not automatically run itself. These programs that have been authorized don't automatically receive funding. And that's where the focus of our advocacy is going to shift now, to make sure that what has been created has follow through.
And Chris, Barbara Hansen has a hand up.
Absolutely. Thank you.
Yeah. I have a question about what might be funded. And because California has our law, putting FASD under OHI, and we also have an education team that's trained to go out and train schools and anyone else, but particularly schools, about the IEP process and assessing and intervention. That's a structure. Is that enough of a structure? I mean, it has a legal basis, it has a training component, and the money I foresee would go towards paying for that training in the school districts in California. How does that land with this?
I think that's
Chris,
a
do you
good
want to take
question,
that, or?
Yeah, it's going to depend. Lawyers always say it's going to depend. So the authorization has the Secretary of HHS make decisions as to what grants are going to go to states. And there's some language in there that says that it's a suggestive language on what states need to do, and that's where the advisory committee and the I just had a senior moment there, Jen. What this
State coordinator?
the coordinator, yeah, that they have that, because it's to look at your all the various systems in your state and how FASD would fit into them and develop a plan. Now, you have done that remarkably well, I think, in the document that was prepared for your education piece. So you're really ahead of the game on that. So, but it's going to depend on what that request for proposal, when it comes out, what it's going to look like.
And that's
Can
going
you
to be
think,
different by state.
It could be different.
Really. Yeah, it could be different state by state, because if the funding is going to the states and the states are delivering the NOFOs, that's going to be very different than if it's a federal NOFO. And at this point, we don't have control over, that's something that the federal government will do. Our advocacy can help influence that both on a federal and a state level. But at this point, there's no, tick, tick, tick these boxes and yes, you're good to go. We're too early in that game. That we still have some advocacy work to do on that as a community.
do you think that that's a solid place to start though? Because there's a structure. I mean, it has to, it seems like we have some very critical things in place.
Oh,
I think
absolutely.
it's a very solid place to start. Yeah, I think it's you're working in the right direction. The trick is going to be to continue working in that direction together and making sure that the advocacy is happening at a state level and continuing at the federal level so that it's influencing those decisions that are being made down the road.
And you'll help us with that, of course.
That is quite literally our job.
Okay, great. Okay, I'm excited about us looking into that further because it just seems like all the pieces are in place and they just need to glue them together. We have the structure. So anyway, thank you.
All right. And it looked like Barbara Weibert has her hand up too, Chris.
Oh, actually,
yes.
yeah.
My question is, does each state get a certain amount of money, or are states competing with each other for amount of money?
At this point, we know how much money has been authorized. Now, whether that authorization turns into appropriations, that's what we have to be working on. And the idea is we want to do this so that nobody's competing with anybody for money. I think it is too soon to know, what that structure is going to look like. I think we're all very interested in the funding coming out, the NOFOs coming out, and all of that. And we still have some work to do before that can happen. And I know Chris is going to go over this a little bit more in depth in the next couple of slides. But we just, I think they're just finishing up the 2026 budget federally, and we're halfway through the 2026 fiscal year. Then they have to get started on 2027, which is likely where our advocacy work will be gaining a bit more traction. And a lot of the infrastructure around how the federal agencies that would be administering these funds still needs to be decided. And those agencies have had a lot of shifting and changing within them. So I think if you're waiting for a NOFO to come out, you probably have at least 6 months to a year and a half before you're going to see that, in all honesty, possibly longer. And we do have a lot more advocacy work to do to get it to that point. And I know that stinks. I know we all worked really hard to get this put through, and we're excited about it and everything. This doesn't happen on its own, right? It happens if we put the work in to do it. And by we, I mean the collective community. So Karen, I see your hand is up, and then if maybe we can move on to the next slide after Karen's question, because I know Chris is going to address a lot of this.
Yeah, I think we're going to end up answering a lot of these, but I'd love to hear from Karen.
Jen, when you responded to my inquiry earlier this week about the update, FASD update, you said that we should get more guidance on which HHS agency will be the lead on the Respect Act provisions. Is there more than one HHS agency?
Federally? Quite a few of them. Quite a few of them. Yes.
Okay.
Yeah. And so the Act directs, and Susan, correct me if I'm wrong on this, it directs HHS to administer this, but they administer this through an agency. and there are multiple agencies under HHS, and we don't know yet. You know, there's SAMHSA, there's
Okay, that's what I was
CDC,
wondering.
there's
Yeah, I was wondering if SAMHSA was included in that, because my agency
depending
is,
on how their funding works, right? So, and again, there's a lot of flux in SAMHSA right now. There's a lot of flux in CDC, right? Like, we just don't know.
okay, so CDC and SAMHSA are all HHS
Right.
agencies. Okay.
Yeah.
I
And
didn't
and
understand that, so
HRSA, the
thank you.
current funding, FASD funding in HHS is CDC, the bulk of it, and then there's 1 million at HRSA. So if things stay the same, it could be that way. But as Jen says, because of all the flux and what's going on, we won't know. For 26, we'll know because that's not changing for 26, but for 27, it could be different.
Um, we've been working on a like a mock application for the FASD Respect Act. And so on our committee, we have Department of Youth Services, we have the Department of Rehabilitation and Corrections, we have a couple of parents, we have the diagnostic clinics here in Ohio. We have the DODD, Department of Developmental Disabilities, and Ohio Department of Health. So from that, I took a poll and asked them what do they think their target population needs. So would I answer it like, would I do a wish list and say I asked for $2 million, right? Would they just say, you're not getting no $2 million, get out of here? Or would they tell me how much money I could get, and then we figure out what we could do with that amount of money?
Yeah, it really depends on what the agency chooses to do. We don't have granular insight into that at the moment, unfortunately. I wish I did. It would make things a lot easier. But that is something that would be controlled and done through the agencies. And that's where, as we advocate with the agencies, it's going to become increasingly important.
Okay.
And I think Dan had a question.
Yeah,
Chris, is it okay if we,
let's absolutely take Dan's, and then I think again, I think a lot of these are going to be answered in the next few slides, but excited to hear from Dan, of course.
Okay, thanks a lot, Chris. Just a quick question. Is there anything in the Respect Act and in the proposed appropriations around the development of, or the redevelopment, I should say, of state FASD coordinators or FASD state coordinators?
Yeah, so that is in the same section actually as the FASD State Task Force or Advisory Committee. The language there says that the Secretary of the HHS may require states to have language for the State Advisory Task Force and for a state coordinator role. This can be, it's loose, right? So states are being encouraged to develop the language for the state coordinator role and the advisory task force, or have them implemented. So yes, Dan, absolutely that is in there.
And Dan, to be
Thanks a
clear,
lot.
we wanted to be a lot more directive on that. Our original language request was saying should and must, not may, but may was what we were able to get past.
Yeah. Yeah, I
And you know the drill.
Yeah, if I had any advice for any of you or any of the states, because the intent really is for states to do this in a thoughtful, strategic manner and to really look at their systems of care across all silos and to determine what, we don't want just, one silo to get funding for training or for this or that. It really needs to look at where are the gaps and the weaknesses and what needs to happen, because that will inform Congress as to the need, will also inform your states as to the need. So you don't want to narrow your focus. You want to really be thoughtful. And this is, and I get back to, what I've said all, you don't know where you're going. If you don't know where you're going, any road will get you there. So it really needs to be a thoughtful process.
And just very quickly, sorry, Chris, Tammy mentioned in the chat the rural health transformational grants. those are open right now in many states. I highly recommend that if you have a state coalition or you have things available in your state involving telehealth or support for rural communities, that you look into those, because that is a pocket of funding that already exists that could be used for, it doesn't say FASD in it. Most of the funding that we find on a state and federal level isn't going to specifically say FASD, but FASD related initiatives could absolutely fit into those grants.
Yeah.
So I highly encourage you to take a look at those if you have any kind of coalition in your state, and see if you may have some projects that you want to do to kind of kick things off, get your seed money going. Maybe you already have some things that have been thought out that could be done in that space with that funding.
Thanks, Jen. And Tammy, that's a great question. I think that's going to be a theme of state advocacy, finding where FASD fits in when FASD is not explicitly named. So usually we would talk about, the status of the FASD Respect Act. We no longer have a status of a bill to talk about. Rather, we're talking about the status of our advocacy, status of implementation, and right now the status of appropriations. So when we talk about state advocacy and what we should be doing at this time, it's understanding state landscape, knowing what's happening in your state right now in FASD, so we can identify, again, where FASD fits in and may not be named and should be named, and it allows us to begin the conversation. You're raising awareness within systems of not only FASD, but FASD-informed organizations. If you happen to be an affiliate or another organization working in the FASD space, it's important to position yourself as a trusted partner, someone that our state government can rely on, which ensures that anything that impacts the FASD community is influenced by the FASD community. And of course, we need to educate on what the Respect Act is, so states are prepared. Lots of talk about appropriations already, so why don't we just give a quick status on what's going on there. We already mentioned the FY26 consolidated appropriations have been passed, albeit extremely late. We know that funds for the FASD Respect Act still need to be appropriated. However, the passed bill does authorize $12.5 million per year. Again, authorization means that Congress had said these programs should exist, and they now technically do exist, but money needs to be appropriated. Money being authorized simply says this amount should be given. Now there needs to be follow-up to make sure that it is given.
And I just want to, and I don't know if this is the place, Chris, maybe here is, that's why Impact Week is going to be really important. We're in the process now of making those requests to increase that 12.5 million. And when we first got in this, and a lot of you have been involved from the beginning, if you recall, the amount was over 100 million and it was a longer bill. And when when you do legislation, you don't have a lot of control. You need to do what you need to do to get it passed. And so we had to put a number in there, and the only number that they would go with was the current appropriation. So we're going to be asking for more money. And I don't know if you want to talk about any specifics on that. We were told when you have an authorization, a new authorization or reauthorization, that you need to do it incrementally every year. So we're going to be asking for 10 million each year for the next 5 years. And to me, it didn't sound like enough, but I think when you start to look at the whole big picture, that gives states to begin to plan and to provide that information, like I said before, to their legislatures as well as to Congress as to the need. And there will be so it'll be more of a planning kind of, and those states that are ahead, certainly if they've got something that they can start on right away. But coming to Washington, D.C. in the end of September is going to be really key to get that message across.
Yeah, I agree, Susan. Thanks for sharing the specifics there. We know what happened last year during Impact Week, when we had everyone up on the Hill. I think some of you were still in town for Hill Day when we got word that the bill passed. So we can make a real impact here with our advocacy throughout the year, and then focused there here in person. Now, some of these notes might be, a little elementary considering we just went over this a little bit, but I just want to make some clarifications for anyone who may be confused. The way the bill is written, it does list FY26 through 30. However, as we know that the Respect Act passed at a strange time after the deadline for fiscal year 26 appropriations has passed. I think we all know what was going on with the continuing resolution. So we are now focused on appropriations for fiscal year 27. When we talk about these appropriations requests for incremental increases, we're talking about programmatic appropriations requests as opposed to community project funding, or something you may know as earmarks or pork barrel. Programmatic appropriations request means that we're requesting funding for a specific program that has authorization. So these are FASD Respect Act programs that have authorizations, as opposed to community project funding that is funding that would go to a specific organization or group to continue, sustain, or begin a new program in your state. While we do, of course, encourage all of you with the capacity to apply for that sort of congressionally directed funding, the programmatic appropriations that we are talking about would increase funding for the entirety of the FASD Respect Act programs, not a specific organization. And then just a tiny bit of clarity on a timeline, because this is how the bill implementation generally works. However, we know it's not how it always works. We went over this a little bit already, but generally a bill will pass. Agencies like the HHS will interpret and offer guidance, and that guidance can come in the form of determining where these programs will be housed. So we already mentioned CDC, HRSA, SAMHSA. At the same time, Congress is working on appropriating that money. These two areas are pressure points for advocacy, and that is what we are currently working on now. Once there's been guidance issued and funding has been appropriated, that is when the funding opportunities come out directly from the government. So it will be coming from the agencies or the departments where the programs will live, followed by states and tribes applying. Annette, I saw you had your hand up. Did you want to offer anything before we move on?
Oh, yes. I just want a clarification from Susan. So she says what we're doing now, we're asking to increase the appropriations from the current 12.5 million. Did you say we're going to ask for 10 million
Correct.
each? And okay, so like say year one, we'll ask for 10 million. Let's say we get it. So then we'll have 22.5 million appropriated. Then the next year, are we going to ask for an additional 10 million so that there will be 32.5 million? Okay. I just want to make sure. I was hoping it wasn't just 10 million per,
Yeah.
Okay. So
No, the
each
guidance
year
we
we're going to
got,
come back and ask for another 10 million and another 10 million so that we finally build to a more reasonable allocation. Okay.
Exactly.
Thank
Exactly.
you.
You're welcome.
yeah, we would have asked for more than that, but the guidance we got from the staff on the appropriations committee is that they really don't look at anything more than that for healthcare related items. And the best way to get this passed and to go through is to show that level up piece. So that way, next time we need to get authorization, they can authorize at current appropriation levels. They will almost never authorize at higher levels than current appropriations, which is why we're at the 12.5 million, unfortunately. So that's where these appropriations are incredibly important, and building that up and working on that every single year to get that level up is going to be absolutely key. And Sid put a really great comment in the chat about how, as important as appropriations are, we do need to be looking at those programs that don't specifically say FASD necessarily, and looking at where we can get coverage for the things that we need to do and the things we want to do as a community through those other funding streams. So sometimes we look for things that specifically say FASD on them because those are ours, but we don't need to wait for that. We can also go out and get and take and find funding that should be covering FASD and isn't. So that's a really great reminder there, Sid. Thank you.
Yeah, and to build on that, that's where the planning goes, and where you identify those in the planning stages, and then maybe there's, when you do the through the planning money, there's money that would be for training or developing materials or whatever it is that would make those programs FASC informed. So you get the bulk of the money through those silos, but there's got to be staff time or whatever to make those, or changing in policy, whatever it is that'll make those that funding FASD informed and friendly.
Quick question. This is Karen. I'm going to be meeting with my leadership, and I want to make sure I understand something that I don't know if Jen or Susan said it, but did one of you say 6 months to a year and a half until the RFP could come out? Was that said?
That's a guess, quite frankly. We genuinely, that is all based on what the federal government does and HHS does and the alignment that they make within the agencies. So for example, at the CDC, which currently holds the bulk of the FASD funding, they have stripped away and gotten rid of a bunch of staff in areas that works on projects like this. And they're supposed to be transferring them over to the AHA agency, not MAHA, but the AHA agency, which really hasn't been formed or structured yet, but is kind of transitioning over apparently. So again, with all of these systems being in flux, to give you a yes, it's going to happen at this point.
Then fiscal year 27 is over.
Well, we don't even have a bill. We don't even have a bill yet for 26.
Do we still get that money
for 26? So, but they've already passed the bill, and they're, those will be passed, obviously. And this one, because it's an election year, it could go, to the end of the year. We can't tell you, and that's why you have to come every month.
Yeah, it's unfortunate, and I don't mean to give you vague answers, Karen. It's that getting the budgets passed, what Congress does with that has a direct impact on this. And if they're not passing the budgets, we don't have so my guess is 6 months to a year. It is literally, I don't see it happening before that.
Yeah, I would agree with that, Jen. Yeah.
But I think the rural health transformation grants might be a good bridge funding piece to look at in the interim.
Well, thank you. I want to thank everyone for the conversation we've had at the beginning here, and I think this is a good time to move on over to our state advocacy implementation piece. And if I can get this to pause. I think what I'm going to do instead, since I'm having some trouble here, I'm just going to set this up and intro it now. What we're moving into now is a phase of advocacy that is, of course, focused in the states. We want to be able to offer you all actionable steps that you can all take right now, throughout the month, throughout the year, to keep moving us forward. Jen, I'm going to give you the opportunity if you want any other intro here, but we want to offer you guys a short little video just showing what's out there, what's possible, and the sort of impact that you can all make. Jen, is there anything else
And
you'd like to offer?
this is still a little bit of a draft. We've got some
Yeah.
refining to do, but we wanted to show you this because we wanted to kind of see it as a call to action in this shift between we've all been really focused on the federal, and now we're going to keep our pedal, keep the gas on the federal, but really shift to supporting how we do things in the states. So yeah, hopefully you can hear it okay. Put in the chat, of course, if you can't, because Zoom and videos is never a great combination. I'm getting no volume, Chris. Can you turn yours up a little bit?
I'll give it another try. Let me know. Something historic just happened for the FASD community. For the first time, the federal government clearly said, FASD matters. With the passage of the FASD Respect Act provisions and the Support Reauthorization Act, we now have federal recognition of FASD across health, education, justice, and social services. But here's the truth. Federal wins open the door. States decide how wide open it swings. That's where you come in. Here are simple ways to connect and make an impact. Call or email your state legislators and share your living experience. Ask for meetings with staff from health, education, child welfare, justice, and behavioral health agencies. Show up, virtually or in person, at hearings, listening sessions, or town halls. Join or start an FASD advocacy group in your state. Ask your state how they plan to use new federal opportunities for FASD. You do not need to be an expert. Your story is the expertise. This moment belongs to parents, to caregivers, and to people with FASD. Federal policy created this opening. State advocacy turns it into lasting support. Your voice matters. Your state is listening. And together, we can build systems that truly work for people with FASD. So Jen, can you let me know, were there massive issues with the audio and the video there? Were people able to get the gist of it? It seems like Barbara Ibrecht.
Yeah, I think well, we're going to send this out once it's completely finalized. But I think we want to start giving you some tools because all of you here are likely already interacting with your state, or hey, maybe you work for the state, right? But what we learned from working on passage of the FASD Respect Act is that one person can't do it alone. One organization, one agency can't do it alone. It takes a community to move these things forward, and it takes a community united in their voices. And yeah, you're going to have disagreements within your community. What community doesn't? But what tools can we give you, can we support you with to get that community active, to get them engaged? So, well, where that video may not have been something that you're like, yeah, I know already. You guys have been talking about this for months. Perhaps as something to share on social media or share with groups that you're meeting with, that can be something helpful to motivate others, right? We see you all as kind of the leaders of the community when it comes to policy, whether you feel like you're a leader or not. Congratulations, you're here, you're it. So I think that's the general idea with this, and really appreciate Chris for voiceovering that. and hope that you will find it useful as it rolls out further. And we've got additional materials to roll out with it that are coming.
Yeah, thank you, Jen. And the idea here is that when taken as a whole, advocacy can feel overwhelming when we have all of these different things we can do. But we're trying to break it down into, again, clear, actionable steps. You can identify people, you can connect with people, you can make an ask, you can follow up, but you don't have to do it all alone. And you don't have to do it all at once. This isn't about being a policy expert. It's about understanding where the influence happens, where decisions are made, and determining how you can influence those decisions, taking manageable steps along the way. The idea here is that by the end of today's session and future sessions throughout the year, you're going to be able to identify at least one concrete step each session that you can take in the next 30 days as we move forward. So the first step is one that, you're all familiar with. It's knowing and understanding the moment. It's knowing that federal advocacy opened the door. Policy created an opportunity for us. The recent federal recognition of FASD is incredibly important and signals legitimacy and renewed urgency. However, most of the services that it is aiming to strengthen, like Medicaid coverage, education, behavioral health services, and access, are actually controlled by the states. So it's the states that decide what happens next. State action will make it possible. This is a shift from advocating for awareness to advocating for action. Without the state level action, we know that change can stall. And this is something that, does happen. I'd love to take just a minute or two, and just a warning, we are forcing in some collaboration and coordination here. So if you feel like sharing, we would love to hear some thoughts. Can anyone think of a time when a federal law has passed, but changes were not implemented locally or at the state level? I can give a very, very broad example. I'd love to hear if anyone else has some thoughts, but if we think back to the 90s when the ADA passed, Americans with Disability Act passed, fantastic policy, right? Necessary, needed, has done a lot of good, continues to, but the buildings didn't, they didn't spawn wheelchair ramps. Curbs didn't automatically have curb cuts in them. These changes had to be literally created, built, implemented. Some of this was influenced by, boots on the ground advocacy. This change was more difficult for certain buildings or certain public spaces based on their capacity to change, the sort of funding that they had. I think we can directly apply this to the FASD Respect Act. If we don't act on the state level, and if we don't advocate for appropriations, not only will there not be money to fulfill the promises of the FASD Respect Act, all of the programs are simply going to remain stagnant. I'm not sure if anyone else has any other examples that they think are pertinent. Totally fine. If not, Jen and Susan, of course, at any times you can jump in. Lex, I'm so glad. There we go. CAPTA is the other example we had in here, but I'm so glad that Lex is jumping in here. They mentioned in the chat, we've definitely seen this challenge with CAPTA and plans of safe care. So states are mandated to implement CAPTA and to have plans of safe care in place for individuals, for infants that are prenatally exposed to substances. However, we know that that's not seen, in which Lex is saying here, the number of families that receive a plan of safe care in most states is incredibly low. Not stealing thunder, Lex, that's why we love to have you here. Sid, I know you're in here as well. This is something that you've mentioned as well. So thank you both. Thank you both for that.
I think though too, that's another funding avenue in your state to
Absolutely.
look at. Look at plans of safe care, because the federal legislation talks about FASD specifically in plans of safe care. And so asking within your state, how are plans of safe care being implemented? How are you documenting the number of children under plans of safe care that that have an FASD or prenatal alcohol exposure? Is that being tracked? Is there funding connected to CAPTA that your group could gain access to? I know a couple of our affiliates are funded through CAPTA funding, through plans of safe care funding. That's a place to look for funding too within your state. So sorry, I know that's a bit of a segue, but anytime
No,
we can
yeah.
highlight pockets or areas that you can look at, we want to do that.
I think that's really helpful. And I want to acknowledge Tammy's comment in the chat because you've brought it up twice with the matching. I want to go back to your original question, Tammy. This is jumping back a few slides. We have not been given any indication. We do not know one way or the other if states will be required to offer any sort of matching to receive federal funding. That's not something that's been indicated to us at all. Jen and Susan, you might have others, but it is good to note that what Tammy is saying in the chat, what prevents states from implementation oftentimes is the need for a state match to receive federal funding, and that is certainly a barrier. Part of understanding the moment, is understanding why states matter, why we're even doing this. Everything on the screen here has a state component. These are all state administered systems. They receive guidance from federal statutes, federal regulations, but they are often implemented on the state level and are hinge on state level decisions. Understanding this helps us shift where we focus our advocacy energy. As you can see, all of these systems are intertwined and should be coordinated. Again, all of these services are in the state. They're not built in Washington. We're talking Medicaid coverage, education, behavioral health systems. Again, these are all state administered systems that do benefit from federal guidance, but particularly local input and local advocacy. We can just take a moment and maybe we can think of which of these systems have you had challenges with? Have you been bounced around the same systems multiple times with referrals? And Jen, I'm taking a moment to just peruse the chat. If you have any sort of challenges that you yourself have faced with any of these systems in your state.
I can tell you that up until 2025, none of my 3 kids with FASD in Washington State qualified for disability services in Washington State because their IQ was too high. Because there was an IQ barrier for disability support in the state of Washington. And that was something where we had to go to the state and advocate and lobby for, I hate to use the word lobby, but we had to advocate for removal of the IQ cutoff so that people in Washington State, of all places, with FASD and a higher IQ could still get access to disability supports. And as we know, that's kind of a gatekeepy thing to getting more supports as you age too. So I think all of these things within states are areas that we do have challenges with and struggles with. And so getting involved and looking at each of those systems, and this is why it's great to have a community of people working with you, looking at those different areas, because one person doing this alone can be really hard. Now, if you are that one person, I encourage you not to be too discouraged because there are other people in other states doing the same thing. And I'm looking at you, Liz McHugh. As I say this, this is where we as a community working together can support each other and looking at those pockets. There's some questions in the chat around some other areas where there might be an opportunity to look at FASD, like Supreme Courts in each state receive money to improve child welfare systems. So looking at the state Supreme Court advisory committees on child welfare, these are great places to get involved if you can. And again, it's really hard for us to put out something that says, okay, here's a list of people to contact, because it really differs state by state. And that's why it's important for all of us to get to know our states and how our state infrastructure works and the agencies operating within our states and what they cover. And Karen, it looks like, has a question.
Well, a comment regarding Chris's question is, in Ohio, the most receptive group of people is the child welfare system to FASD education and awareness. We're trying to perform some trainings with the parole system. It's like very, very difficult trying to get them to accept that they have these individuals within their systems. So we're working diligently to try to tailor our training toward them and let them know it's not extra work we're asking them to do, but just giving them information and awareness that would hopefully help them to get their parolee successfully off parole. But that's a hard partnership, is the justice system. And the easiest one for us child welfare has asked for trainings. We've done a curriculum on how they can follow through with identifying FASD and what agencies within the state will be able to help them to get the needs of the child met. But yeah, those two agencies stick out to me. Those two entities. Thank you.
I can let Jen and Susan jump in as well. I think it's great that child welfare has been receptive, and I'm sorry that the parole board has been less receptive. I think this is one of those things that can be communicated in the same way that we want to communicate alcohol use during our checkups. It should, I think, be universal, that avoids stigmatizing, it avoids placing it as like this is only something to be concerned with for people who are thinking about being pregnant, but rather we should have these trainings and this education for any system or any group that is coming into contact with FASD. Jen or Susan, did you have any input on Karen's comment there?
I have heard, agreeing with you, Karen, that it can be challenging to approach the legal system because the what's in it for them. And I think this is where it's going to be important that we share, okay, Ohio is working with the judicial system. Who else? What other states are working with the judicial system? How can we get you guys together and get you talking so you can share what best practices, what is working on that. And so that's an area where we need to start documenting and keeping track of, okay, who's working with who on what, not to control it, but to facilitate these conversations so those best practices can be shared. And Chris, I have a hunch we're not going to make it through the full presentation today.
Yeah.
These have been such great questions, and I'm so glad everybody's asking them.
Well, let me just offer a few ways that you can actually get started on this process that we've laid out here. One of the first steps, actionable steps, is identifying contacts. Every person here has a state representative or an assembly person and maybe a state senator. Although Susan let me know that if you're in Nebraska, it's unicameral, you got one. That's fine. Each of these legislators likely serves on a committee. When we're talking about FASD, relevant committees in your state, legislative committees might include health, human services and education, behavioral health, maybe even appropriations or budget committees. Those committees and in the legislators where policy language is shaped and funding decisions are made, these legislators are one part of the picture in your state. So while the policy is made in the legislature, implementation happens in the agencies at different departments. These relevant agencies might be departments of health and human services, education, or different Medicaid agencies. It's those agencies that are interpreting, offering guidance, and operationalizing, making the policy real. That's why we're advocating across the board in the state with your legislators and with key agencies. Before we move on, because we are making the shift into state advocacy away from federal advocacy, this is something we did it for years, and I'm tempted to have Jen start singing her song. But if you're able to right now, I'm going to ask everyone to either use this QR code on their phone or go ahead and go to congress.gov, where you should be able to locate your state legislator's website. Maybe you already know your state legislator's website. If you don't, again, this QR code is going to take you to a map on congress.gov. You can click on your state. Once you do that, it's going to bring you right to your state legislator website. There, you're going to be able to find your state representative, find your state senator. You can see all of the different state agencies listed out on most of these state websites. I mean, you should also be able to locate relevant committees. I'm going to pause for just a minute and take a look at the chat. But I do encourage everyone now, if you have not already, to take a look at your state legislator website and identify who your state representative, your state assembly member, your state senator is. Take that information down. And that's the first step you can take towards reaching out and making contact. Once you've taken that step, you're able to connect. Your next step can be to connect. This is not something that requires any sort of expertise or experience. At bare minimum, staff is logging your constituent concern. It's saying that you called about FASD. And at most, you're educating someone on FASD who's never heard of FASD before. You can start as simple as you want. Send an email introducing yourself. Again, this is either to a legislator or a state agency. You can request a short meeting. You can attend a town hall, a public event, or some sort of gathering organized by your representative and ask a question. I know there are advocates on this call who have done this. It's how a bill was introduced in the Texas legislature. A member of the Texas advocacy group attended a meeting maybe a year or 2 years ago. There was a staff member of the state legislator at that meeting. They brought this information to their boss and they helped introduce a bill. You never know what is going to happen. And, at the bare minimum, you're raising awareness, you're getting FASD out there, and you're making yourself and your FASD visible. It's important to remember that this conversation isn't about winning. It's about building a relationship and sustained presence. And I know we are at the time. The rest of the presentation is honestly just this slide. So if you have time, I'll ask you guys to stick with us very quickly as we talk about an effective story, framing your story. I'm sure all of you are practiced at this and have done this in your own advocacy. But if you haven't, it's important to know that these stories are powerful when they connect your living experience to a systems change. Start with who you are. Pair that with an identified systems gap or a gap in supports. And you're going to use that to inform an example of something you think needs to change. That's the formula. In my example, can say, I'm a school psychologist. I have been for about 10 years. I've experience working with all sorts of children in schools. And what I've noticed is that there is no state level or statewide guidance on how to identify or refer individuals with FASD. I'm asking you to offer statewide guidance to educators and providers so we know exactly how we should be identifying and referring individuals to services. Keep it clear, focused, and actionable. And now a challenge. All of you have been doing work on this for years, and it's been tireless at times, but you can all see the good that can come from it. And I hope after this session, you can see how easy it is to take the first step and the supports that we are here to offer if you need help with that first step. But before you leave, if you're still on with us, again, thank you very much. I'm just asking you to write down, in your notebook, wherever you keep notes in your calendar, one thing that you think you can do in the next 30 days to take your first step. It could be finding a contact for your state legislator. It could be writing down which legislative committees you think are relevant, or writing down a list of state agencies so then you can go in and find contacts for them. It could be requesting a meeting. It could be sharing your story with a legislator. Whatever it is, make it something that you think is realistic and actionable that you can do in the next 30 days. Again, advocacy right now is about sustained presence, positioning yourself as a trusted partner, so the FASD community always has a say in what impacts it. Again, you're not being called to be a policy expert, and this certainly isn't about doing everything. It's about doing something and then continuing to do something. In closing, if there's one thing that we learned from advocacy for the FASD Respect Act, it's that this is a powerful movement that can get work done. And it's something that people want to join in and help when we give them the chance. So we ask everyone right now to start where you live, advocate where it counts, and begin by taking the first step in your states.
And Chris, just a comment in the chat asking about, is the state advocacy toolkit a clickable link? Do we have a link for that we can throw in the chat?
Yeah, one moment.
Excellent. And I need to apologize. We have to use this Zoom account for another meeting that was to have started a couple of minutes ago. So definitely email us, call us if you have questions. Thank you for being here. Thank you for taking the extra time. And we appreciate it.